Hi, I'm Sue, and this is Lauren, and we work for Fox Valley Plastic Surgery in the Vein Center in Oshkosh, Wisconsin. Thanks for joining us for a varicose vein video today. How do you know you have varicose veins? The obvious signs would be the big blue veins on the lower legs.
But there are some other symptoms that people can experience as well, and these can include swelling, itching and burning of the legs, a feeling of heaviness, and then as the disease progresses, you can get skin discoloration, and then worst case scenario, ulcerations of the skin.
Some people that walk around with the varicose veins feel that they have no problems. They feel the legs are just fine. The varicose vein disease is a very slow progression of the vein issue. Sometimes you don't know how bad the legs actually feel until we start cleaning up the varicose veins for you, and you start to get more energy back and you feel less fatigue and less heavy with the legs. There are other people out there too that have no obvious signs, but they have heavy legs, they're tender, they're itchy, they burn, and they're very tired at the end of the day, but they don't know they have the varicose vein disease.
So you may have varicose vein disease, and there can be some risk factors that can contribute to this. These can include a family history or genetic background of varicose vein disease. This can include being female. Females are more predisposed than males. However, men do experience this disease, and we do treat many men in our office as well. Pregnancy is a predisposing factor, and so these can get worse during pregnancy and then persist afterwards as well. People who sit or stand for long periods of time, this can include people who work in a factory where they're on their feet all day, and this can include more sedentary jobs too. Age over 50 is predisposing as well. However, we have many people who are younger than that come into the office for treatment as well.
How do you know if you have varicose vein disease? You need an ultrasound. The ultrasound will diagnose varicose vein disease. And if that would happen, we have multiple procedures that we could do.
All of the procedures that we have to offer are minimally invasive, and so there's no surgeries or incisions made, and our options are customized to each patient. Some of the procedures that we have to offer are radiofrequency, laser, VenaSeal, and then injections including Varithena or echosclerotherapy. There's minimal downtime after all of these procedures. Most people can return to work the very next day. The only thing that you may have to do is wear compression hose for a short time period after.
When you come in for your ultrasound for the screening portion, we'll do the ultrasound, and after the ultrasound, we actually come up with a customizable treatment plan specifically for you. Not every person that we see coming in the door will get the same treatment plan. It's based upon your anatomy, the size of your veins, and what treatment would be best for closure for you.
All of these procedures can be run through your insurance company, and so most procedures that we do are fully covered by insurance.
We are an accredited vascular lab from the national body, the IAC. That's a really big deal. We need to support all of our findings, and we need to send in documentation for our ultrasound studies every third-year basis.
Once you've completed treatment with us, we continue to follow you for a full year afterwards to ensure that everything that we have done has been successful.
You will see me from the start of the process all the way to your ending appointment time. Once we're completed with the varicose vein treatments, we offer a lot of different cosmetic procedures that we can do, and we can also take care of hand veins and feet veins.
The next step would be to call our office. We will be able to schedule you for a free complimentary vein consult. At that consult, you'll meet with either Sue or myself, and we will go over your symptoms as well as perform a physical exam. If we suspect vein disease, the next step would be to set up a screening ultrasound. This screening ultrasound is typically covered by insurance, and that would be the next step in the process. Vein disease does not heal itself. It continues to progress and get worse over time. So call our office today.
Let's see how good we can make your legs feel. Thanks for watching. This is Sue and Lauren from Fox Valley Plastic Surgery.